Why did you choose pharmacy?
Long story. But the short of it is that I was impressed at somewhere around age 5 or 6 with a tea that my maternal grandmother made that made me feel tremendously better quickly. And it was from a plant, looked to me like a weed, from the front yard. I had to know, though, that it wasn't just a plant or just a weed, because of all the things in the yard, this seemed to be protected. And it was a tea that was bitter, but it was quick. I didn't know then what I know now, and that is pharmacognosy, getting drugs from plants. That actually guided me through my undergraduate in biology to pharmacy school, and halfway through pharmacy school, I knew I was going to go on for another degree, and because of a seminar, I really got stimulated to look at what was next, and I was choosing between what was then post-baccalaureate PharmD programs and PhD. I ended up going into the laboratory because of the science orientation. Pharmacy then for me has been a long track filled with people and events and experiences that helped me and guided me in terms of making choices. Pharmacy has been a very good profession for me.
How do you view the profession currently?
I view the profession as one that serves the community. Pharmacists care for people. That's what we do. Pharmaceutical sciences and scientists make it possible to care for people through their discoveries and even their business practices that are established. That is how pharmacy is viewed by the public, and we know that when pharmacists are looked at, that we are so highly respected. Everybody can get to us, everybody wants to get to us, so that they can hear from us and understand their medications better. After all, pharmacists are the people that makes the medications work.
What makes a good pharmacy student?
A good pharmacy student is one that obviously is going to be a really good student. You have to always be learning and understanding that you have to be nimble, you have to be agile in learning, because not every course will require the same of you in terms of study skills, for example. You have to learn that a certain content will require a certain approach. I had to learn this all the way through the graduate school, and I might even say my day-to-day job as dean, because of the fact that I have different people across campus that I work with, not just the people who are my direct supervisors in terms of the provost office or my president, but the staff around them. Everyone has a style, everyone has an approach, everyone has a way they like to engage people in terms of getting the job done. And you're more effective if you understand what that is and how to respond to it to make it work for both of you.
What is the job outlook in pharmacy?
You know, we were just at the American Pharmacists Association meeting, and this topic was one of the first workshops. In fact, it was the first one that I attended. One of our own graduates, in fact, now at the University of Minnesota, Dr. Caroline Gaither, was the actual person who led this panel giving data. And there were a couple of takeaways. One is that, yes, the outlook remains the supply and demand are about equal. And what that means is that you won't get multiple offers. You may or may not get a signing bonus. You will get a signing bonus, I've learned in just a few last few weeks, if you go into a place where they have had difficulty in placing a practitioner. And that would be, of course, in places that are rural. That is to say, you won't be in Cleveland, you may be in Podunk or somewhere like that. And that means that you may not be able to live as you're accustomed to because the cost of living would be lower, but that you would have a satisfying practice in a place where people need you. And so that when you look and think about that first practice opportunity in particular, one should understand that it may not be at home, and that's okay. It can be in a place where there are fewer people with greater need, where your talents can be applied.
Lastly, what does the future hold?
The future is always bright for pharmacy. When you graduate, you're upper middle class instantly. There's high job security with our profession. There are also the stresses that go with any profession because you're caring for people. You don't want to make mistakes. You always want to be on top of your game, practicing at the highest point of your license. And you want to practice in those states. Ohio is one of them. that actually allows you to use most of what you were trained for, by statute, I mean. And so one has to look at the future and be optimistic about it, and also be opportunistic about it, so that you can create the opportunity within your practice sphere that allows you to use all of the knowledge and skills that you've gained.